So as usual, I'll start and go a little fast so that I can revise when other students they come.
اوكي. اكتب اللي يدخل لا يسلم او يسلم صوت واطي
لا يسلم بالمرة.
احسن بعد يسلم.
Any problem?
No, just
All right. So don't worry about a little. Now we are going into a little tough, okay? Because up till now you were thinking that we are revising the things which we did in the first semester, but now we are making it a little tough. But don't worry about the exam. Just worry about learning the basic concepts. Do you remember I told you that most of your patients as a physical therapist, they will be from neurology. They will have problems from the motor system or the sensory system. For sensory system, you cannot do anything. But for motor system, you can do a lot of things. So from here on, we are going to get a little serious about these topics. All right. So do you know reflex? What is reflex?
yes. touch hot thing, you pull your hand away.
So how will you define reflex? This is our next lecture. But today, because I will be using this thing, so I will mention it.
The stimulus go to the spine cord and go back
So this is called
to the muscle.
reflex arc, cos. But if we say the definition, this is anatomy, then this is immediate and involuntary response to a stimulus. This is reflex. So who controls the reflex? The reflex is controlled by spinal cord. Okay? But there is a higher control. I gave you an example before. Are you looking at the slides, my dear? Okay. I have not started the slides. That is why I say, first listen to me, then go to the slides. Because I'm not in the slides. Just wait for me. Same for you, brother. He is reading. So what are I doing? I am not teaching from the slide. Okay, thank you. So what I am saying is this, that reflex is controlled by the spinal cord. So this will be our next lecture. Now, last time I discussed with you the kink, that is the cerebral cortex, and two wazir, that is cerebellum and the basal ganglia. Now we are going into the concept of the brain stem, and the brain stem, what functions it performs. It's not the kink, but can it perform some functions? So number one, you will remember that brain stem, it is controlling our breathing, it is controlling our heart, it is controlling our emotions, it is controlling our alertness, things like that. Number two, we cannot live without the cortex because we cannot do the voluntary functions without the cortex. Now, two words will make concept, then I'll go into the slides, inshallah. Do you have clear concept of the cerebrum, Ra? And do you have clear concept of cerebellum, Lam? Or no? So I'm not enjoying because you are not responding at all. When you don't answer, then I start and I run on the slide. Do you have clear concept? Say no, khalas. You are my sons. What's the problem? When the teacher is helping, take the help. Do you know Ra, cerebrum? Do you know cerebellum? Yes. Okay. So this is the thing which we must make a concept of it. The king's name is
Cortex.
What is the name of the king?
Cerebral cortex.
You know, so this is cerebrum.
That's the king?
This is the king.
No.
But everything, the top and center. The top is called cortex.
Okay.
And in the center is called medulla. See, so keep these words in mind before I go further. Now, this is sitting on this. This thing is sitting on this. You understand? When I make pain to you, who feels it? This
the brain stem.
This feels it and makes us alert. But it does not know where is the pain. Try to understand. If I put a pin here, this will tell me there is pain. It is here, here, here. Who tells this? This. Because there is an area for every part of your body. I'll make cartoon, okay? For every part of our body there is an area. Likewise, if I want to move the leg, who makes the decision?
Cortex.
Cortex. See? So pick up the word. Cortex is the outer layer of the king. This is all is called Ra. Cerebrum. Okay? This is Ra. That is why I said cerebrum. Ra. And here, what is here? So if you put the brain stem like this, then at this place, I'm sorry for the marker because this is called cerebellum. Lamb. Alright? Is this the king? This is the king. Thank you. So, just this concept we make. This is cerebellum. Lamb. See? This is, you remember I told you, it helps the king in making decisions.
Sure.
And it makes jasus. This is the one. Okay, so this just keep in mind. Now here we have two concepts to keep in mind. One, the outer surface. Yes, it is called cortex. Bas, now I can go.
Keep it. It's
Okay, discuss. Yes, if I need that, I'll take from here.
Okay.
Alright, so now today we will make concept about the brain stem and the spinal cord. Next week, the last two lectures, they will be a little more tough. We will discuss disease and reflexes. That if this is cut, what will happen? If this is cut, what will happen? Because a lot of people, they are getting accidents. We should know in our mind when we are a good physical therapist that how much can I help and how can I help. Alright, Bismillahirrahmanirrahim. So, starting again from the first lecture, we have got the king, highest level. Then we have got the sensory motor cortex, that is why I explained it to you, which has got two helpers, basal ganglia and cerebellum. This is maktab barid, thalamus. Yani all the information is coming to thalamus from everywhere. But then the motor command, see my hands carefully, because this I will use inshallah after 1 hour. The cortex, it is giving direct fibers to the spinal cord, and it is giving indirect fibers through the brain stem. Try to understand now this concept. Let's make the concept and then I will go fast. Cortex is sending direct fibers to the spinal cord. What is the function of spinal cord? Reflex. What is the function of spinal cord? To give the nerve to our muscles. What is the function of spinal cord? Motor activity. What is the function of spinal cord? To take the sensory nerve and send it to maktab barid, thalamus, which will send it to the brain. So here what is the function of the spinal cord? It receives, number one, direct fibers from the cortex, motor cortex. Number two is today's topic. Some fibers go to the brain stem, and from the brain stem they go to the spinal cord. I will make a better diagram in the next page, after a few pages, inshallah. Then there are fibers going to the muscles, which are called motor neuron. This is our topic, motor nervous system. This is what my topic, receptor and the sensory system. This I am not discussing with you. Our 8 lectures are for motor system. Alright, so the brain stem, it is made up of the midbrain. This is called midbrain. And then it is made up of the pons, midbrain, pons. And then it is made up of medulla. And what starts after medulla? Spinal cord. What is above the midbrain? We have got the cortex.
cortex.
You know, in between is thalamus and hypothalamus and all these things. Thalamus is mainly sensory. So our discussion now, first topic is brain stem. Now, please read this sentence carefully. It is giving origin to all the descending tracts except for corticospinal tract. See, what is the name of this?
Cortex.
Cortex. What is the name of this?
Spinal.
Spine.
Spine.
So what is corticospinal?
The wire.
It is the motor tract.
Trunk.
Why we say motor tract?
Because it's
Because first is cortex. If it was spinothalamic, then it will be
spinal.
sensory, because it is starting from the spine. You understand? This is anatomy. So corticospinal.
Cortical spinal.
So if you remove corticospinal, rest all tracts, they originate from where? Brainstem.
Brainstem.
This is the concept which we want to make, that all the tracts, what is the meaning of tract? Nerve fibers.
Nerve fiber.
What are the two types of nerve fibers? Sensory and motor. What is my topic?
Motor.
What is the second name? Descending tracts. What did I say? I said I have come out of the kink, cortex. Now our topic is brainstem. We want to discuss what are the functions of brainstem. What are the three parts of the brainstem?
Midbrain.
Midbrain,
And
pons,
medulla.
medulla. What tracks start? Okay, this is next diagram, but just a minute. Last point over here is this. Number 1 point was this, that a lot of motor activity is controlled by brainstem. You understand? If you remove the cortex, can you move the leg?
No.
You see, no. But can the leg move? Try to understand what I am saying. Can I move leg? Yani, I thought I will move leg. Number 2, can the leg move automatically and my brain is cut? Yes. This is what we are making the concept. Slowly. It controls our heart function, our blood vessel function. Heartbeat increase, decrease, blood vessel constriction or dilatation, respiratory system, increase in breathing, decrease in breathing. I have half adrenaline, my heart rate increases. I have half adrenaline, I have bronchodilation, more breathing. Function of the brainstem. I am not controlling it. It is what you say under the conscious level. Shu'ur and under the shu'ur, tahta shu'ur. You understand? Brainstem. Digestive system. Do you know about the stomach secretion? Do you know about, can you control your intestinal movement? No. Automatic. So there is some control here in the brainstem. We start now slowly. Why there is a cross here and cross here and cross here?
Cortical spinal. Because we're not studying it. Or
What is CS?
central
Corticospinal.
cortex.
CS from corticospinal. Corticospinal tract has two parts. Lateral corticospinal tract, anterior corticospinal tract. Listen, there is a nucleus from where a tract comes which is called tectospinal. A nucleus from where a tract comes rubrospinal. A nucleus from where a tract comes reticulospinal. A place from where the tract comes vestibulospinal. I go back. What is written here?
All these ascending tracks except cortical spine. That's the XY. Why there is an X?
All the descending tracts start from the brainstem except for corticospinal tract. This is written over here.
Okay.
Alright? So now, can I control my leg with tectospinal tract? No.
Because it's voluntary.
Because it is from brainstem. It's not coming from the cortex. But can the leg be controlled automatically by tectospinal tract? Yes. If your patient has bleeding in the brain, if your patient has bleeding in the brain and he gets into Shalal, this is what we are discussing. His brain stem is fine. This is what you will play with. You can give electrical stimulation. You can make his muscle move. Yani, you can play what the cortex was doing with voltage. This is what our next 4 lectures are. We are discussing these points. All right. If you sit there, or just make your chair so that it keeps seeing you, or just keep on moving. Yeah, here. I hope, inshallah, it will not go. Now it will just look at you and think that you are sitting. After some time, you just make like this, okay? Jazakallah. All right. So, have we made the concept that which, if I give you MCQ, which of the following does not originate from brainstem? And I write tectospinal, reticulospinal, vestibulospinal, corticospinal.
Cortical spine.
Okay. So this is typical of the short answer question or whatever you call it. So, lateral vestibular nucleus, now I am going back. I am picking up these names. Vestibulo, reticulo, tecto, rubro. So, lateral vestibular nucleus, extensor activity. Pontine reticular formation, extensor activity. Red nucleus or rubro. Rubro means ahmar, red. Medullary reticular formation, flexor activity. So influences of the brain stem centers on spinal reflexes, regulation of muscle reflexes, involved with equilibrium and posture. So this was the beginning. Now, how did we learn it? We learned it by Zul, by making experiment on the animals. So the scientists, now alhamdulillah we do not do it, but we have learned it. The scientists 2 centuries back, in 1700, 1800, they were doing this. Cutting the spinal cord at different level, cutting between the different places. I'll go back to this diagram. So they will cut from here. Now if some function is under this, it will be not function of cortex. Are you understanding?
Yes.
It will be function of the area of medulla and below it. Then they will cut from here. Then they will cut from here. Then they will cut from here. The most common place is cutting from here. If you cut from here, what is this place?
Midbrain.
This is the start of the
Stem.
brainstem. So if you cut from here and make the experiment on the animal, it is zulm. But this is telling us that if there is bleeding in the brain, or there is cancer in the brain, or there is infection in the brain, or there is accident of a person on motorbike or a car and his leg goes like this and it is broken from here,
Shudder.
what will we get in the legs? You see? So that is why they made this very bad experiments. An animal in which all the brain is cut. So what is left? Spinal cord. And they cut below medulla. An animal in which decerebrate, yani, look at this poor animal. They keep it alive, yani, by giving blood and by giving oxygen and everything. But they cut the brain part. Midbrain animal, yani they cut at the midbrain level. Thalamic animal, yani they see the function of thalamus by cutting all the other areas except for thalamus. And decorticate animal. That is why I gave you the concept of cortex. If you remove the cortex, it is called decorticate animal. And I will give the seal for it. But see one example of the decerebrate animal in which the cerebrum is cut. I go back once again. Yani, if you cut from this level, this means it is purely brainstem. It is not having the king. The cerebrum is removed. Now this animal, surprise, it can stand. This animal, its back is like this. We say concave. There is muhaddat and there is muqar. So this is, back is like this. Its tail is like this. We say it is dorsiflex tail. Head is dorsiflex. So what I am giving you, yani, you have cut from here. The king is removed, but still the animal can stand. So this is called caricature of standing. This curve and this position is called opisthotonus. Don't worry about the exam. You trust me, alhamdulillah, with renal system, with acid-base balance, with introduction. I've always given you good tutorials, and you have all done good in exam. So don't worry about the exam, just make the concept. So our today's concept is about the result of the animal experiment. Animal with a brain stem but without higher center can stand, can take steps with sport. Yani, if we put the animal on the floor, it can try to do like this. Yani, this proves that the brain stem controls reflexes. Adjust the posture. We try to make the animal fall down, the animal tries to make balance. But they have problem with the balance and they have problem with muscle coordination. Yani, when we walk like this, if the animal will try walking, it will make these two go together or these two legs go together. Yani, it's not normal walking, but still muscle activity is there. So this proves that the brain stem is involved in the posture correction. This is called rightening reflex or anti-gravity mechanism, control of tawazun or equilibrium, and coordination of muscles throughout the body. So we have now become wise by learning the basic function of brain stem, and now we are going fast. Now, what are the important functions of brain stem? So it is the word other. So first three are here. What are the functions of brain stem? Posture connection, control of equilibrium, coordination of muscle throughout the body, and other functions, reception and integration of all synaptic input from spinal cord. Listen, we are learning a new word, interesting, reticular activating system. What is its function? On the next slide. Here only one line. Arousal and activation of cerebral cortex to keep us awake. Wake up, there is pain. Run, there is pain. Cry, there is pain. You see? So who makes us alert? This is a part of the brainstem which is called reticular activating system. I will tell you on the next slide, inshallah. Sleep and wake cycle. Yani, it's so easy. This does not make us sleep. This does not make us sleep. This sleeps when the signal comes from the brainstem. It tells switch off. I give the example. This is the bulb. It does not go on and off. I go there and make switch off from there. And this bulb goes off. So we go to this diagram and we understand it very simply, and then we see. See, this is the reticular activating system. We don't read it. It receives the impulses from the spinal cord. It receives the impulses from our ears. It receives the impulses from our VN. See, you have something very interesting in front of you. This is what happens to you every night. Even last night, when you were on your mobile and you were doing something and you were scrolling and then you started seeing a video and you did not realize it was already Fajr time. Visual signal. Remove the visual signal, you will sleep. Auditory signal. You know, you are in your room and the boy who is living above, if you live in the boarding here, in the midnight, he is playing football. This happened. The boys who live in the boarding, they know it, you know, who don't live in their home. Or maybe in your home, your younger brother on the upper floor, he is playing football. So auditory. Now you are hearing and you cannot sleep. Tuck, 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 you know. You cannot sleep. So 2, 3, something is bugging you, something is pinching you, there is some bug in your bed. Can you sleep?
No.
So the stimuli, they come from different places. SubhanAllah, this is my specialty, and in Applied Sciences College we have got a specialty, it is called sleep therapy, and we have their separate lectures. They are different from physical therapy. Now, if we want a person to sleep, number one, bring him to my lecture. He will sleep himself. Or the best thing is this, we make a room which has got the color which the person likes. You see, put red color, 90% people, they will not like it, you know. Maybe someone, one or two out of you say it's okay. Put a light blue color, many people, they will like it. Sometimes we are surprised why most of the office buildings and schools and colleges, they have off-white color or white color. You see? We put the white bed sheets. We make the room temperature 23. You understand? And we make no sound. The best is this, we put asbestos over here. So no sound will come. You know, many of your homes, they have a window with one glass. And some of your homes, they have double glass. This is called double glass, you know. So why do we make it? Number one, it's insulation. Number two, noise does not come. There is a truck going outside. Now you can sleep, you know. So the reticular activating system, it is connected with our eyes, it is connected with our ears, it is connected with our spinal cord. So that if something is disturbing us, you see? And it says, listen, king, all okay in the kingdom, sleep. And the king makes everything sleep. You understand?
Yes.
And suddenly, there is a big bang outside. Doom. You hear it. Now the king has made all the body sleep. This tells the king, wake up, wake up, wake up. There is some problem. Have you made the concept?
Yes.
Let's read it. So the reticular activating system, it has got connection with it has got connection with the ascending sensory tracts, touch, pain, temperature, vibration, pressure, etc. It has got connection with eyes, visual impulses. It has got connection with the ears, auditory impulses. Using all them, it can make us weep. It can make us cry. I have got pain. Stop making this noise. Is this time to play football on my roof? You understand? So what is the word? Alertness. You are in my lecture and
Yes.
you sleep. And he makes this boy alert. Wake up. So wakefulness and alertness. And listen to my lecture carefully. Every word which I am saying. This is called attention. Yani we make our thought on something. What we are reading or what we are seeing or what we are doing. So let's close the story. One of the biggest functions of brainstem after these three basic functions is reticular activating system, arousal and activation of the cerebral cortex, sleep-wake cycle, and help in the sensation of pain. It is connected with all the areas. It keeps us alert, wakeful, and maintenance of attention. It is related to our emotional reaction to stimuli from the eyes, from the ear, from the pain, from the pressure, from the touch coming from the body. My dears, we learn a very interesting thing. What is our topic for those who are not, who are a little late? We are discussing functions of brainstem. Last time we discussed the king, the cortex, the cerebrum. Today we are discussing brainstem, spinal cord. Now, if you remember in the slide number 2, I told you that the brain stem, it is made up of
Pons.
midbrain, pons, medulla. Do you know that we have got 12 pairs of cranial nerves? Not spinal nerve, cranial nerves. How many?
12.
12. See, if this is above the pons, this is pons, and this is below the pons, we have formula of 4. 4 nerves above pons, 4 nerves from the pons, and 4 nerves below the pons. Yani subhanallah, almost all the nerves, cranial nerves, not spinal nerves, they originate from the brain stem. So we say brain stem is origin of most of the cranial nerves. These 8 are coming from the brain stem. Trigeminal nerve, abducens nerve, facial nerve, vestibular, very quickly. This is not my job. Trigeminal nerve is controlling my facial muscles. Facial nerve is also controlling my facial muscles. Trigeminal is also controlling my eye movements. But abducent nerve and trochlear nerve, this is controlling my eye movements mainly. I have 6 eye movements, not 4. You see, I can see this side, I can see this side. I can see up, I can see down. I can see this angle, I can see this angle. I can see this angle, I can see this angle. You understand?
Yes.
So there are technically 6 movements of eye which are possible and 6 muscles in the eye. So they are controlled by 3 nerves: oculomotor nerve, trochlear nerve, and abducent nerve. Glossopharyngeal, as the name tells you, it is with our tongue and our swallowing. Vagus nerve, 75% of our body parasympathetic. Hypoglossal nerve, it is again with the movement and the function of the tongue, so this makes it speak as well, and it takes our taste as well. Accessory nerve makes me move these muscles. Subhanallah, except for the optic nerve and the olfactory nerve. This is controlling my vision, and this is controlling my smell. All are directly coming out of the brainstem. Do we now know the function of brainstem?
Automatically.
Does it have control of the eye? Does it have control of these muscles? What is the function of these muscles? They help me balance myself,
Yes.
to control my exoskeleton.
Yes. The griddle muscle.
Does it have anything to do with my facial expression?
No.
Brainstem.
No, it's because it's.
So yes, it has. See facial nerve, see trigeminal nerve. This is what I am saying.
But isn't it motor that you smile?
Right here, this is motor. So we are discussing motor.
Oh.
This is motor.
Yes.
So what we say is this. Listen carefully. Now, 12 nerves can be damaged if the brainstem is damaged. Agreed?
Yes.
Well,
How do we know what is the function of brainstem? If the brainstem has problem, we have vision problem in seeing, pupil bobo, abnormality. It is constriction in the light and dilatation in the
duck.
it doesn't want us to straight. You take care of it. Sorry.
But the PowerPoint is on still.
It's on, but why it ran away from us?
Yeah, I'm sure.
Maybe my click of hand. All right. So changes in sensation, hearing problem, vertigo. Vertigo means we think we are rotating. Okay. Swallowing and speech difficulty, change in voice, coordination problem, muscle weakness. Did I discuss it with you?
Yes.
Where? I discussed it with you. We are here. Once again.
Facial.
Smelling, seeing, moving the eye, moving the eye, moving the eye. Facial expression muscles, hearing and balance, tongue, taste and tongue movement, all the parasympathetic system, the tongue movement and speech, my muscles of the back which control my axial skeleton, you know, all this is damaged if we have got damage to the brain stem.
Yes.
Subhanallah, these are string functions which are controlled by the brain stem, and we do not think of it. So this slide you will use for your preparation of the quiz, and you will find inshallah the tutorial. I will prepare the tutorial again like the question, you know, short question, so that you don't have to read the wrong answers. Just, you know, if you know the correct answer, you will do the MCQs as well, inshallah. There was no problem with most of your students in the introduction and renal. Okay, so just tutorial will be like this. So it is a link, brainstem is a link between spinal cord and the higher centers. Autonomic centers for cardiovascular system, respiration, GIT. This is vagus nerve. Regulation of muscle reflexes in equilibrium and posture. This is accessory nerve. Control of many stereotype movement of the body, yani which we make coordination. Control of the eye movement. I told you 3 nerves. Modulation of sense of pain. I told you reticular activating system. Reticular formation, receive and integrate all synaptic input. Sleep modulation. Yani this is all the function. The switch of all these functions is there in the brain stem. What is the topic? So those of you who were not here when I started, I will go back. I am discussing this thing. We have made experiments on different animals. Today we will discuss decerebrate and decorticate, and next inshallah we will discuss the spinal. So we have different problems if a person gets shalal, brain bleeding, cancer, infection, accident. One of them is called decorticate rigidity. What is this word?
Cortex.
Cortex. If you remove the cortex, what will be the name? Decorticate. How can you remove the cortex in a normal person?
Cut.
No, not cutting. Accident, bleeding, punch. You understand? Cancer. Something damages the cortex. That is why I started today with cortex. It is the outer layer. So if you remove the cortex, what will happen? We will have extended legs. Do you know extension?
Yeah.
Do you know what is the problem with the legs? The legs are like this.
Fully extended. It's,
You will be taught the detail in your physical therapy classes, how to manage this patient. This will be your commonest patient, and you have to make decision between this and this. What is the name?
decerebrate.
Rigidity. Okay. Look at this. Is this flexion or extension of the elbow?
Flexion.
Flexion. Look at this. Is this flexion or extension?
Extension.
Extension. What is this?
Flexion.
Flexion. Flexion where?
Out.
Wrist. 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 Sahi? Fingers also flexion. Sahi? What about this one? Adduction.
Adduction.
This is decerebrate. I go back. Adduction. Flexion. But look, the arms are coming towards the spinal cord and stiff, and the legs are like this. You cannot make them like this. What is the problem? The cortex is removed. The cortex is damaged. The cortex is injured. The cortex is infected. So decorticate rigidity due to the lesion of cerebral cortex. That is why today I put detail of Ra and Lam. Of cerebral cortex, with most of brainstem intact, lead to extensor rigidity in legs and moderate flexion in the arms. So this is called decorticate posture. One MCQ. Now, how is this different? This is different because we have got extension over here, pronation over here, flexion over here, but same extension and plantar flexion over here. This is decerebrate. That is why I said cerebrum. So we cut the cerebrum. We damaged the cerebrum. The blood vessels of cerebrum, they were damaged. Before we had only cortex damaged. Now all the cerebrum is damaged. Big problem. You see? So changes, lead an interruption of some descending pathways such as from the cerebral cortex, corticospinal tract, but pathways from brain stem is intact. Changes in the balance between excitatory and inhibitory control, leading to exaggeration of spinal reflexes. This we'll discuss inshallah in the next lecture. Spinal reflexes. Inhibition of some reflexes, for example, flexion reflex. So please understand that the taqabul or difference between decorticate rigidity and decerebrate rigidity, and who will tell me the meaning of rigidity?
The folds.
Rigidity?
hard thing يعني
So simple word is it becomes like a stone.
hard, yes.
It becomes hard. Yes. And this is your main job, make it loose.
Soft or
Yes.
loose, yeah.
Make it loose. How will you do it? You will learn it in your physical therapy classes. So this is our little detailed comparison. Damn simple one for common people, because you have to tell this thing to the common person who are the relatives. So there is damage to midbrain, decorticate flexion. C means it is like this C. Decerebrate, deep damage yani from here. Decerebrate is extension. Decorticate is flexion. And decerebrate is extension. My dears, as we come down from here, the next stop after medulla is our spinal cord. Now, although we will go into the detail of reflexes next time, but today I started with reflexes just to give you the idea that we are basically preparing for our next lecture where we will have all diseases. But today also our second lecture will be disease. Function of spinal cord, have I discussed it with you just now? Tell me 1, 2, 3.
Function.
First start from,
Cord,
it is Tariqus Sari. For one road is coming from the Mam to Khubar, the other is going from Khubar to the Mam. Yani for sensory system and for the motor system. The tracks are coming from the receptors to the higher centers, and from the higher centers to the effector. Receptor, effector, muscle. Then I told you the second function, that is reflex control, you remember? So these are the functions of the spinal cord. It is the link for transmission between the brain and the rest of the body. Final common pathway for somatomotor system, home to motor neuron pool. So this is motor. This is from the Mam to Khubar. And conveys somatosensory information from the body. This is from Khubar to the Mam, sensory system. See? It is center for
reflex.
Reflex. See, for the last time today, next time I will do it again and again. I touch it, I do not know, this is current. And I make like this. This is a reflex. And I have discussed with you, if I have a girl, I will make cry. You see? And if the dean is sitting here, or the president is sitting here, and I get this current, what will I do?
Transverse it.
I will control it.
Oh, okay.
So this means a small baby cannot control the urine. When the bladder is full, passes urine. Whether the king is sitting or the president is sitting, it doesn't care. Agreed?
Yes.
Agree.
But we can control our urine. You understand? So yani, the spinal cord can control all the reflexes. It is the markers, it is the reflex center. but the brain has some control on it, which I discussed with you just now. If you cut it, the reflex will be there. There is no problem. But the control will be lost. Alright. It gives origin to pre-ganglionic fibers of autonomic nervous system. We have 4 things to discuss. We will go slowly. Spinal neurons, motor unit. We discussed this with you in the first semester as well. And again, we will make it at a higher level in preparation for our next lecture. Muscle spindle and Golgi tendon organ, there are 2 receptors, but they are very important in our learning of the motor system. So number 1, we have got how many spinal nerves?
5.
5, 10, 15, 20, 25, 30.
From the brainstem is 12.
Brainstem is cranial nerve.
Cranial as well.
Don't mix them up, but speak like this so that we make our concept clear. Brainstem is cranial nerve.
Cranial.
Forget about that. Finish.
Mm.
My spinal cord is not controlling my eye. My spinal cord is not controlling my speaking. My spinal cord is not controlling my speech. It is not controlling my food taken. It is not controlling my smell. This is not function of spinal cord. This is function of brainstem.
Brainstem.
Now come to spinal cord and forget about brainstem. So we have got increase 2 more. 31.
31.
We have got 31 pairs of nerves. 8 Jama 12. So 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. So how many pairs? This is, I'll give you. Always, he has always problem.
We have doctor.
How many pairs?
31.
31. 31 on this side, 31 on
Other side.
that side. And make formula for it, okay? We know everything, you know. We sit on S1, sacral 1. When I'm sitting, I sit on my S1.
Mm.
Under my foot is L5. You will be knowing it. And you have to learn it from anatomy. Because this is your job to make proper stimulation for everything. Whatever is ordered. So number 1, learn that how many spinal nerves do we have. I go to my topic. Number 1. What is a motor unit? This is from first semester. Now, this is spinal cord and this is alpha motor neuron. Alpha motor neuron. Alpha motor neuron. What is alpha motor neuron? Please make the concept with me. Just 1 minute. This is cortex. This is spinal cord. And this is the muscle. We say it is the effector. Spinal cord has right and left. Alright? It has origin of a motor neuron over here. This is called alpha motor neuron. We're discussing motor, not sensory. This gives the nerve to the muscle. This is point number 1. So, what is the name of this thing?
Alpha motor.
Alpha motor. Now, from cortex, some fibers directly come here. Alright? Come where?
Alpha.
Where?
Alpha
motor
motor.
neuron. Alright? Is this up or down? This one?
Down to descending.
This is up.
Up.
So what is the name for this?
Cortex alpha tract.
Wonderful. Wonderful. Upper motor neuron. مخفف UMN. What is the name for this? Lower motor neuron. Where does the lower motor neuron start?
Alpha motor.
Spinal cord.
Don't say spinal cord, say alpha motor neuron in spinal cord.
Alpha motor, you know.
Where does the lower motor neuron end? On the muscle.
Vector. Okay, yeah.
On the muscle. Where does the upper motor neuron start?
Cortex.
On the cortex.
Right. And now last point. And we have got, come on,
Middle.
what was my first part of the lecture?
Brainstem.
Brainstem. What was my first point there in the brainstem?
3 parts.
All the tracts, except for the corticospinal tract, they start from here. So they also come exactly here. But this goes here also. Alright, let's repeat. What will be the name of this neuron?
Corticospinal.
No, very good, very good. Corticospinal. Corticospinal neuron is
Upper
upper.
motor. Cortex.
Alright? Alright? What is the name of this nerve here?
Arm
Give me
nerve.
name for any nerve. Yes, you are right. Ulnar nerve, median nerve, radial nerve. Are you listening? What type of neuron is this nerve?
No.
Lower motor neuron.
Why did you say this?
Because
Out of the spinal cord.
Because it is out of spinal cord. It is coming from spinal cord. You understand? Now listen. Bullet. A person was hit here.
Lack of control.
he can't move.
Very good. What will be the name of the disease?
Neuroplasia.
Shalal.
Shalal, sahi, but there is a name. You see, even if I cut it from here, it will be shalal.
Spasticity.
So there is difference. So that is why we have got first name, which is upper motor neuron lien. What if some person puts a knife for me like this? Here.
Lower.
Lower motor neuron.
Lower motor neuron lien. I cut it here. You understand? This is the concept that we have made here, and then I go back to this topic. Now, this is not one. There are many alpha motor neurons here. And now I can shift to my slide. Now, one alpha motor neuron and all the muscle fibers that it supplies. For example, this is the color. This is the color. This is different color. So this light color is supplying this, this and this. So we have got definition that one alpha motor neuron along with all the muscle fibers it supplies is called
Motor units.
motor unit. Listen, listen, listen. One alpha motor neuron and all the fibers that it supply is called
Motor units.
So the first concept we have made. Now please give me full attention for 1 minute. This is here. I pick it up. Do I need some muscle here?
Yes.
To pick it up?
Yes.
Agreed? Can I take you back? Put the zip off. No, I need big one. Now I pick it up. And it is full, mashallah. 50 kilo. This was 100 gram. And same hand I am picking this up. What is the difference?
Weight.
Wonderful, but please help me more.
More units.
More motor units.
More motor units.
This is called motor recruitment. See, you are making hand wrestling. See? and I am very weak. He knows he's Baba, 670 years old. And he wants to put less force. He wants me to win. Ikram.
Ikram, yeah.
You see? And then when I go on the side, he comes. And now they are really fighting. You understand?
Yes.
This is, you can recruit more motor units. You can pick up 1 kg. You can pick up 10 kg. Now I am shifting to the weightlifting, okay? You are in the gym and you are enjoying, see, mashallah, he can pick up 100 kg. Subhanallah. You understand? And now this person, he can pick up 105 kg. And I can pick up 20 kg. Are you with me? You understand what I'm saying?
Yes.
So this means we can involve more motor units. And we can train our muscles. That is a separate topic. So this topic is called motor unit recruitment. As the weight goes on increasing, we can increase the power by adding more motor units. This is called motor unit recruitment. A little tafsil, little detail of what I said. Smallest motor unit, small force. Small jama medium motor unit, medium force. Small plus medium plus large motor unit, yani all the muscle is involved. Now I am picking up 105 kg. Put the attendance and just, leave the mobile. A teacher can see everything. I don't, last time also I had this argument with you, remember? You see on this if you want to see. Otherwise, listen to me. 1, 2. I know he is also making the lecture, but listen to me. Last time also I told you the same thing. You came late 1 hour, I put attendance for 2 hours. No problem. So, our problem is this. We have a disease. Again, I will discuss it inshallah in the next lecture. The disease name is poliomyelitis. It kills this. What is this? Alpha motor neuron. Have you heard of polio?
What?
Polio? Have you heard of polio?
That's an actor, right?
It is a disease in the small children where a virus goes and it makes a type of shuttle. The limb it goes atrophied. Finished. Because these are killed. Alpha motor neurons. So we'll have these examples next week inshallah, all these diseases together. But here I am just telling you, motor unit, recruitment of motor unit, and a little detail of recruitment of motor unit. And then we go to the next point, which is the understanding of the muscle activity. What things are to be recorded when a muscle is doing some activity? Can I harm myself if I am pushing this up?
Can you what?
Can I harm myself?
Yes.
Make some problem for me?
Yes.
If I'm pushing it up?
Muscle tearing, yes.
So he says muscle tear. What is muscle tear? Like this,
You can't-
muscle breaks.
It can't handle.
Does it happen normally?
No.
So Allah subhanahu wa ta'ala has put a defense system in our body. And there is another thing which happens more commonly, that is our muscle, it comes out from our bone. Yani, it is like we eat the meat from the bone, the old style. If you are sitting alone, you enjoy eating the meat from the bone. If you are sitting in mahfil, then you eat it with,
Or,
proper thing. So, if you do like this, same, our muscle can be pulled from our bone. So this is tear, what he said, and the other is tendon is removed.
Yes.
Muscle length can increase too much, and the muscle can tear. Number 1. Number 2, muscle tension can increase too much and the muscle can come out of the bone, you know. So this is about the tendon. So we need to record the length of the muscle, rate of change of the length of the muscle, and we need to record the tension in the muscle. How much tension is there in the muscle? Because tension will break it from the bone. It will remove it from the bone. And the change in length will tear it. This is the problem. Next lecture I will show you a couple of photographs as well. So Allah subhanahu wa ta'ala has given us two receptors. One which records the length and rate of change of length. This is called muscle spindle. The second, which is called Golgi tendon organ, which records the tension. Tendon tension. Tendon tension. Golgi tendon organ is for recording the tension. I go back. Parameters to be monitored during muscle contraction. To be automatically safe. Allah subhanahu wa ta'ala has made a system in us. I will never touch 105 kg, lift it, try to lift it. No. Even if I try to lift it, my muscles will tell me stop. But this person who is trained for 130 kg, you must have seen this small videos, this beard person, I think Pavlov or whatever his name is. He comes and he picks up, you know, he comes like sweeper and he picks up.
Oh yes.
You know, it comes automatically, this small video, it comes. He comes like a sweeper and he picks up the weight which no one can pick it up. I will never dare to pick 50 kg because Allah subhanahu wa ta'ala has given me two receptors. One which records
The tendon.
tension.
Tension.
What is the name? Golgi tendon organ. And one which records,
The weight, the force,
one which records
strength,
the length.
strength, length.
Okay? So length and rate of change of length muscle spindle and tension is Golgi tendon organ. So these two keep our muscles safe and now tafsil for them. This is very important learning for you. You know why? You have got a person who cannot control his muscle and he is lying and you have to stimulate his muscle. Will you like to give his muscle so much tension that it breaks?
No.
Because he cannot control it. That is why we are learning this thing. So we have to be careful about these maneuvers. So number one, I am starting with this one, then I will go to this one. So number one is muscle spindle. It is present in the belly of each striated muscle. Each muscle, each muscle, each skeletal muscle, each striated muscle. It has got a muscle spindle inside. We have got rule of two. I'll keep on telling you. So it records two things. What two things it records? Length and rate of change of length. How much is the length and how fast is the length changing? Listen, have you all seen this in the movies? Next week I will tell you.
Yes.
Yes.
Jerk.
This is jerk. This is knee jerk. Next week this is our topic, inshallah. What happened? What happened? See.
Reflex.
This is my muscle, which the footballers break, you know. You know the name, quads,
Yes.
quadriceps. This is its tendon. I hit on this tendon, this becomes long because I hit.
That's a reflex.
And automatically there is a reflex which makes this muscle short. When this becomes short, my leg go like this. So doctor does like this and this happens. Yeah. Now listen carefully. Now listen carefully. If this is the problem, what is the name of the problem? Lower motor neuron lesion. Will this happen? No. Why it's not happening? Because the connection with the spinal cord, which is the center of the reflex, is finished. Understand? If not, no problem. After a few slides, you will understand.
Good.
Who is recording? recording? Recording what? Recording what? Again,
Four.
I am changing the length of my muscle. Who is recording?
Spindle.
The muscle spindle. This is my discussion. This is my discussion. So every muscle has got muscle spindle, which has got two types of fibers, extrafusal fibers and intrafusal fiber. It has two functions. It records length of muscle and change in length of muscle. What is muscle spindle? It is a receptor inside the skeletal muscle. See? I said rule of 2, 2, 2. Of so many two things. Some more two things. It has got two sensory nerve fibers. It has got two motor nerve fibers. Again, we have got two receptors. One records the length and change in length, the other records tension and the change in tension. Muscle spindle is present in the striated muscle belly. It has got two types of fibers, intrafusal fiber and extrafusal fiber. It has got two types of nerve supply, sensory and motor. It has got two sensory nerves and it has got two motor nerves. Let's name them. Don't run away. Very simple. So intrafusal fibers are innervated by two types of afferent neuron that send sensory input to the central nervous system. First is primary sensory nerve ending or type 1A fibers. And the other is simple name type 2 fibers. So type 1 fibers, type 1A fibers and type 2 fibers. So this is at the center and this is at the ends. So this is the sensory neuron of muscle spindle. And then I said it has got same two motor neurons. It has got alpha motor neuron, which we have discussed. But it has got a special motor neuron inside, which is called gamma motor neuron. Now I am making the things coming towards physiology from histology. So we have got two sensory nerves, we have got two motor nerves, and we have got this muscle spindle in the muscle belly. Now, what is the role of gamma motor neuron? See, alpha we have already learned that alpha is present in the spinal cord and it brings the message of reflex from the spinal cord to the muscle. Gamma motor neuron, it is in the contractile region of intrafusal fibers. These regions are innervated by gamma afferent fibers. The tension of intrafusal fibers is maintained during active contraction by gamma activity. The system is informed about very small changes in muscle length. You did not understand anything. Don't worry, we have got explanation. Of the same, this is explained, 2 slides for explaining this point. Because when you will read it, this is easy. Alpha, gamma must work together. You see, my eyes and my brain must work together. My tongue and my brain must work together. Otherwise, I will not be knowing what I am saying. You understand? Alpha and gamma must work together. Let's see. So it is co-activation which maintains spindle function. What is when the muscle contracts? What is the function of spindle?
Sensor
Length
length.
and change in length. It records.
records.
When it will be doing it normally? When both alpha and motor, they are functioning normally. Let's see. 1, 1, 1, 1. 2, 2, 2. 3, 3. Now what is step number 1? Alpha motor neuron fires and gamma motor neuron fires. Yani both work together. Fire means action potential. And the muscle shortens. See, this is my muscle. I change its length by hitting here. Tuck. If alpha and gamma together work, this will become
Retract.
short.
Short.
Why it becomes short?
To protect itself.
Very good, protection. What did I start with? What are the problems with the muscle contraction? He said tear. If we change the length, you see, he stands on one side and he stands on the other side and start pulling my jacket like this. What will happen?
Tear.
Why tear?
What?
Because length was changed. You understand? Now, speed of change. I was passing from here and there is a hook here, small hook, you know, and my coat went like this and I was going fast towards Saleh. Tear.
Yes.
You understand? Who stops it?
Spin traction.
The shortening. Who causes shortening?
Garment.
Muscle spindle.
Muscle spindle.
How?
Sensors.
By co-activation of alpha and gamma.
Co-activation. So if one is damaged, there is no.
What is the job? To make the muscle short. Forget about the spinal cord. We have to do it in the muscle. So, alpha motor and gamma motor fire together, muscle contract, stretch on centers of intrafusal fiber unchanged, firing rate of efferent neurons remain constant, muscle shortens. Now see the change. This is co-activation. Now, if gamma motor axons are cut, the spindle loses activity when muscle contracts. If the gamma motor neurons are cut, alpha motor neuron fires, there is no gamma motor neuron. Muscle contracts, less stretch on center, firing rate of spindle sensory neuron decreases. So this is a bad response in which our muscle can really tear. So this your teachers in the physical therapy, they will teach you in simple terms to make you understand that when you are stimulating the dead nerves which are cut from the spinal cord or above level, you can stimulate the muscle, but you have to keep the contraction, length, and the change rate of the length in a control. So this is the story of the first receptor, that is muscle spindle. Now the second receptor is Golgi tendon organ. I told you tendon is for tension, so it is located in the tendons, you know. It is located in the tendon. They are supplied by afferent fibers and excited by both stretch and contraction of the muscle. They are sensitive to changes in the muscle tension. So with this you can write the mark for yourself that this can be a short answer question. What is the function of the Golgi tendon organ? So its function is to record the change in the tension of the muscle. Yes, what is the time?
11.
18. So inshallah I continue and because I have covered this topic there. You see I have covered this topic here. So I will go fast and inshallah we will finish by 40 or 45. So please stop me here if you have not understood this. A neuron starting from the cortex and coming directly to the alpha motor neuron is direct corticospinal tract. It is upper motor neuron. If it is damaged here, for any reason, forget about the bullet, cancer, bleeding. You understand? Only one point to understand now. Right side of the brain controls
Left side.
left side. And the left side of the brain controls
Right
right
side.
side. For this we go to the next slide and we make the concept here. Starting from here. Now I am shifting from the board, exactly the same thing I have brought it here. Isn't it the same thing?
The same.
Name the, do not look at the slide. Do not look at the slide. Name this thing.
Alpha motor.
Name this area.
Cortex.
Cortex.
Cerebral.
Name this side.
Right.
Right. This is actually left, you know.
Oh.
Yes. Because in our medical science we call it left. This is left. This is right. As if you are seeing the patient from the front. Okay. So that is why this is our rule. But no problem for me for making that. Okay. This is left. This is right. What is this?
Brainstem.
Give me the big name. What is this?
Cortex.
Upper motor neuron.
Okay.
What is this?
Muscle.
Muscle.
Spindle.
I don't like the name muscle. Give the second name. Effector.
Effector.
Sahi, muscle, perfect. We are discussing muscle, motor. But the best name is effector. Give me the name of this one.
Lower
motor neuron. Give me the name of this region.
Brainstem.
Brainstem.
Brains.
Give me the name of this place exactly. Medulla.
Medulla.
What happens to upper motor neuron when it passes the medulla?
Go to
It
the.
goes to the opposite side.
Yes.
It crosses over to the opposite side. Do you know the difficult word for crossing? Anatomy? Decussation. Decussation. Not physiology, don't worry. If the female side give question decussation, I will write in bracket crossing to the opposite side, okay?
Okay.
But for anatomy, I cannot do anything. Decussation means crossing.
That is.
Right side is controlling the left side is controlling the right side. Sahi?
Sahih?
Now let's name these things. Muscle or effector, alpha motor neuron, lower motor neuron, sahi? Corticospinal tract or upper motor neuron. The same thing I have brought it here. And motor cortex and upper motor neuron. Are you with me? Let's make it complicated. Now I am going here. You remember I put this specially here.
Yes.
Do I need to go back 25 slides?
No.
You remember my slide when I told you that all the tracks except for corticospinal tract originate from
Cerebral.
brainstem.
Brainstem.
This is what we discussed in the first few slides. So listen, cerebral cortex, corticospinal tract direct, but goes to the opposite side. This is showing crossing and reaches the. Please wake up for just 30 seconds because then you will not understand the next slides. I have to teach you two terms here. This is called direct upper motor neuron, sahi? Corticospinal tract. What is happening here? This is brainstem or the other nuclei. Remember the name reticulospinal which I told you, vestibulospinal which I told you, the red or rubrospinal which I told you when we were discussing brainstem. So these are those fibers. They are called extrapyramidal tracts. Because corticospinal tract, this is called pyramidal tracts. What is pyramid? A haram misr.
Yeah.
Pyramid, makhrut. This is extrapyramidal. So cerebral cortex crosses to the opposite side, comes to the brainstem, and this is indirect. This is direct. This is indirect. This is first thing that we are learning. Direct, indirect. Direct, indirect. Any question? What does direct mean? Listen,
From the cerebral.
I have to tell something to him, and I tell him, do this. This is direct. And I do not talk to him, I tell Saleh, please tell him to come to me.
Come to him.
This is
Indirect.
indirect.
And then.
This is indirect. Cerebral cortex to other nuclei and then other fibers from other nuclei. Those of you who came late, this we discussed in the first few slides. That is, there are many tracts. This is the first thing that we have learned. Direct, indirect, direct, indirect. Second thing, can you tell me what is final common pathway? Can you define final common pathway looking at this slide?
Lower motor.
Look at this, look at this, look
Yes.
at this.
Yeah, the lower motor.
And define it, everyone. Keep quiet in your mind, define it. What is final common pathway? What is the meaning of final in Arabic? What is the meaning of common?
آخر طريق مشترك.
It is mushtarak. Yani, one road is coming from Abkek, one is coming from Jubail, one is coming from Dammam, one is coming from Dahran. You have to reach the university. You understand? All the roads, they come and they meet at one road which is coming towards university. Can you define final common pathway? Where is it started?
Alpha motor.
From the
Alpha
Alpha
motor.
motor
Where is it going? To university.
till Masdar.
So this is final common pathway. So we have learned on this slide two new things: direct and indirect. You see, I wanted him to do something. I wanted him to come to me at 8 a.m. I told him, come to me at 8 a.m. How simple? Sahi? Direct. Indirect. I told Saleh that tell him to come to me at 8. Saleh thought, he's always lazy. So I will tell him come at 7:45. And he made small adjustment.
Sure.
So this is indirect. Yani it is not pure like I said, come at 8. Now he tells him, come to Dr. Ahmed at 7:45. You understand? So this is the difference between direct and indirect. Which one will be doing the best movements? The fine movements, the typing, touching your touch screen things, throwing the ball in the basketball loop, hitting the ball in a way that it goes into the goal, giving a good pass. Direct. Who's making me walk, making my balance when I fall? It's very simple. How we know it? Again, those who came a little late, because we learned it from the animal
Cats.
experiments, that they are done by the brainstem. They are not controlled. King does not waste power in these very small reflexes. Walking looks very difficult, but an animal in whom you have cut the brain from here can walk with sport. See?
صح.
Now we make this concept for the last time, this one, because we want to add one more thing. So motor cortex, fiber coming, crossing to the opposite side in the brain stem and ending on the alpha motor neuron in the spinal cord. This is the upper motor neuron. The nerve fiber starting from the spinal cord going down, this is the lower motor neuron. But the new concept in this slide, don't forget about 12 cranial nerves. Remember we discussed 12 cranial nerves today.
Yes, three.
What is the concept? So from motor cortex to the nucleus of the cranial nerve, from where the lower motor neuron it starts. So it is not reaching the spinal cord. It is from the cortex just going to the brain stem, from where trochlear nerve, abducent nerve, trigeminal nerve, facial nerve, vagus nerve, vestibulocochlear nerve, glossopharyngeal nerve, which we discussed today in the brain stem. So, have we made the concept of lower motor neuron? In case of spinal cord, it starts. Where does the lower motor neuron start in spinal cord?
Cord.
Alpha motor.
Alpha motor.
Where does it start in the cranial nerve? From the nucleus of the cranial nerve. Have we made the concept of upper motor neuron? Yes. Where does it start? It starts from the cortex. It ends where? It ends on the alpha motor neuron. It ends where? It ends on the nucleus of the cranial nerve. So the concept of upper and lower motor neuron, and this is tafsil. I don't need to speak. You can read it when you want. Upper motor neuron originate in the, this is what I said just now, okay?
Yes.
Originate in the motor region of the cerebral cortex and of the brain stem, yani direct and indirect. This is also upper motor neuron. So some start from here, brain stem.
Walking.
That is why I made this concept over here, so that you are not confused. So make a circle that I have explained it to you. Become a witness, shahid, that I have discussed with you both these things. They start from the cortex or from the brainstem. This upper motor neuron, it is starting from the brainstem. This is indirect. This is starting direct from the cortex. This is direct. This is what is written over here. These neurons connect the brain to the appropriate level in the spinal cord, from which point nerve signal continue to the muscle by means of lower motor neuron. You can write at this place with your pen alpha motor neuron. That is, they come and end on the alpha motor neuron in the spinal cord. So that your concept is clear. Now we come to the lower motor neuron. So they are the motor neuron connecting the brainstem and the spinal cord to muscle fiber, transmitting nerve impulses from the upper motor neuron to the muscle. A lower motor neuron's axon terminates on an effector or the muscle. Here again you write on the spinal cord alpha motor neuron. So that you know this ends on
Alpha.
Alpha motor neuron. Be confident. This starts on
Alpha motor.
So upper motor neuron ends on alpha motor neuron,
This starts
and lower motor neuron starts at the
Alpha motor neuron.
direct, indirect, very fast. Main connection of corticospinal tract is with lower motor neuron that innervate the muscles of the distal extremities. This control the hand and the foot. That is why I said typing. That is why I said your touch screen. That is why I said throwing the basketball. Indirect. The corticospinal tract has connection with the brain stem. These indirectly affect my balance, anti-gravity, jazbiya, anti-gravity. So my balance and sport is controlled by indirect. So two types of pathways. When there is lesion of the upper motor neuron, clinical findings are combination of both direct and indirect. Now we come into our disease. I said next lecture also disease. And today, last 15 minutes, disease. Bleeding, cancer, infection, bullet. This is what we are discussing. Accident, breaking the neck, breaking the spinal cord, sleeping prince. You know about sleeping prince?
Yeah, princess.
If not, learn it. Upper motor neuron lesion can be cerebral infarction, decreased blood flow, finishing blood flow. Here, lower motor neuron here, like I cut here. So upper motor neuron in the cranial nerve, lower motor neuron in the cranial nerve. So this gives us the definition. We will learn both and we will compare it on 6-7 slides. So there will be repetition. But basically this slide will be enough for making the basic concept.
Just a question. Suppose that damage the lower, actually to the lower neuron for someone. Okay, and we can transplant artificial neuron for him.
So yes.
Does that can lead to strength and precision beyond the natural limits, or there are limits from the brain?
The thing is this, that if someone makes this, he will get 2 Nobel Prize. So far we have not been able to do it. And we cannot connect. Otherwise we will finish this disease of Shalal. You see? But yes, the point is this, it is now difficult for you to understand, but just few years back, your elder brother or father, they can understand this. We used to have wires of telephone from STC. This wire going to his home, this wire going to his home, this wire going to his home. This number is 2394, this number is 2395, this number is 2396. When we connect, we can connect, but how can we join his number with his nerve with the brain?
No.
This we do not have any formula for it. So, answer to your question, even if we join,
Okay, if we can transplant
Say.
artificial neuron,
say,
if the
complete
natural
neuron,
neuron level neuron had a image, okay,
say,
that can lead to strength and precision
say,
more than natural limit.
that is what I was discussing in the last topic. You put a new, any imaginary, he said supposedly. You put a new neuron from this alpha neuron to the muscle. It will start functioning normally. Yes, it is possible that the brain's exact signal is not transmitted as good as I was telling him, come to me at 8.
Okay, that means the spinal cord and the brain they detect the strength.
Not spinal cord alone. You listen to my previous topic, muscle spindle. With its function is to detect the length or change in the length.
Okay.
Golgi tendon organ, its function is they are present in the muscle. Bismillah, no problem. You put the new nerve, get the Nobel Prize, and it will start functioning normally. People have experimented, by the way, with the animal nerves, putting one rat's nerve into another rat. They have experimented?
Yeah.
Yes. The problem is this, that the same problem which I said, I don't know which number is 5, which number is 4, which number is 3. Because one nerve is not one nerve. It is many motor units. This is the problem. Yani, even one muscle, we have got so many neurons coming. So this is the story. Anyway, so upper motor neuron Lian, welcome. It is the damage of upper motor neuron in the higher center of the descending motor tract, causes stroke. You all know about stroke. Cerebrovascular accident, bleeding or blockage. This leads to decreased blood flow, trauma, bullet, accident, boxing, rugby. We have seen people dying by the football, tumor, cancer, infection, many other reasons. Sites, my dear, please remember this. I am not going into detail of anatomy. Most common place where we get the upper motor neuron Lian. Did I teach you this? UMLL?
Yes.
Upper motor neuron Lian. Okay? Upper motor neuron Lian. It is in the internal capsule, an area of the brain, internal capsule. What happens? Have we learned the word direct and indirect?
Yes.
Come to me at 8 and he tells him 7:45. So if there is upper motor neuron Lian, there are loss of direct effect and there is loss of indirect effect. What is direct effect? Listen, I said control of the hand, typing, touch, throwing the ball, accurate hitting the ball to the goal. See, is this proximal or distal?
Distal.
Distal. You see, I cannot write. I cannot hold this.
Yeah.
Yani this weakness, I try to put A and it hits somewhere else. Now let's learn the difficult words. Loss of distal extremity strength. Distal, not proximal. Loss of distal extremity dexterity, skillfulness. Translate skill into Arabic. Maharat.
Bara. Yes.
Your expertise. I am khattat. I am naqash. You understand? So this is dexterity. Yani this beauty finishes. And this we learn on the next slide. There is a special thing which is called Babinski sign. These three are the loss of direct effect. And what happens by loss of indirect effect? Remember, I told you my balance and things like this. Number one, increase muscle tone. Number two, hyperreflexia. See, this is my
B.
normal. How do I know it is normal? Because I have learned it in the last many years. And I compare it with the other side. And now, nothing. Absent reflex. And now, hyperreflex. What does hyperreflex mean?
More than normal.
That the upper control is lost. Listen, president is sitting here. And this is current. What did I do? What he did. You see, I controlled it. God forbid I have upper motor neuron lean.
Okay.
Normal reflex. So this is hyperreflexia. Clasp knife. Have you seen this? The knife, you know, which opens like this. There is a knife which opens like this. Translate it into Arabic. Not khanjar, it is the small
Hand.
sekin, you know.
Yeah, hand pockets or something like that.
Yes, you can fold it. And it does not close easily. It closes like this. This knife,
Pockets, knife.
pocket knife. So your muscle, it contracts like this. Not smooth. Opens like this. You see? So this is called clasp-like rigidity. MCQ. Which one of them is the indirect effect? 1, 2, 3, 4.
And the cholesterol.
Which one of them is direct effect? 1, 2, 3, 4. You understand?
Yes.
All right. Shalal.
Mm.
Two new words. Shalal. What is this?
Paralysis.
What does paresis and paralysis differ?
Paralysis can't move.
Paralysis is loss of muscle function.
The others.
Paresis is
Weakness.
weakness. It is not weakness due to diarrhea or due to sweating. It is weakness same like diarrhea or sweating. You have had diarrhea, severe diarrhea, and I cannot stand, I have got weakness. You understand? My muscles, I have lost my electrolytes. Same, but it is because of the nervous system. Paresis. You know, my right side is weak, left side is fine. You make, Assalamu alaikum. See, the doctor sees it like this. Other hand. Press my hands. Press my hands.
يتخاط.
Both equal, alhamdulillah. This one weak. What's the problem? This one normal. This is weak. Very good. Other side of the brain, he has problem. You understand? Paresis. Shalal is simple. Paralysis. Cannot move. Loss of function. Paralysis. Contralateral means, I told you before,
The opposite side.
opposite side. Same is called ipsilateral. 1, 2. Now we go for more. Other characteristics. Yani I am repeating the same slide but in detail. And I told you I will do it 6 times. Spasticity. Yani this is brother of rigidity. But difference is this, rigid is hard. Spastic is contracted
Contract.
and hard.
And heart.
So it is caused by loss of inhibitory control on the spinal reflexes. Increased tendon jerk and colonus. Babinski sign present. It is next slide. Yani I am repeating the same slide. The paralyzed muscles show no or minimal atrophy. Listen, main difference between upper motor neuron and lower motor neuron. Lower motor neuron we will have atrophy after 6 months. muscle will disappear unless you are helping. Passive exercise. Upper motor neuron muscle atrophy does not take place because the spinal cord is there, alpha motor neuron is there, reflex is there. This is basic learning. So minimal or no atrophy, normal response to electrical stimulation, best patient for physical therapy. Best patient for physical therapy. We can help them a lot because this nerve is not damaged. What is Babinski sign? In Babinski sign, we stroke the outer side of the foot with some blunt thing, not sharp thing, don't damage his foot. So we do it like this. Normal person foot will do like this. Darcy. Abnormal person will do like this. This is called Babinski sign. This is present in small babies because they don't have the brain development. And this is the sign of the upper motor neuron lesion. I go back very quickly. This is the sign of the direct. Sign? Alright, how do we do it? Yani very simple. Normal plantar response, which is called, plantar flexion. This is normal. This is dorsiflexion. This is extensor plantar response. Babinski sign is present not in lower motor neuron. It is present in the upper motor neuron lesion. My dears, the concept which we have discussed. Damage it here, 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 here. It is on the opposite side. But damage it here, yani after the crossing, the effect will be on the same side. Upper motor neuron lesion on same side of clinical finding if lesion is in the spinal cord below the crossing over. Like this we will give in the exam, decussation, crossing over. So if it is below the crossing, it is on the same side. If it is above the crossing, it is on the opposite side. 6 not completed, 6 will be completed later. This is upper motor, now lower motor. It is damage of the lower motor neuron, the spinal anterior horn cells of spinal cord and the cranial motor nuclei on their axon, resulting in skeletal muscle paralysis. This one causes trauma, or now comes the biggest disease of Saudi Arabia, diabetes, mardus sukkar. Diabetes or alcohol, and again an infection disease, poliomyelitis. What happens? Lower motor neuron damage from here. What happens? Number 1, the nerve degenerates. Sometimes it regenerates, muscle atrophies. One important point, increased acetylcholine receptors. Please write full name here because we wrote short name. Acetylcholine receptor. These are histological changes. What are the results of these changes? Flexid paralysis. Listen, up till now I have discussed rigidity and spasticity. Now this person's muscles are like this. You pick it up, it goes like this. It is soft. Yes. Like you say a thing which is not living. You see? So the word is soft. Difficult word is flaccid. It is not flex, it is flaccid. Yani, it is very soft. Like your teddy bear. You see, like your toy. Fasciculation and fibrillation. Very small difference. When you cut the nerve, the other part of the nerve, which is down, it is still there. Although it is cut, you see, it is cut from here, but it is still present. It is cut, but it is present. A little stimulation over here will cause the muscle to do like this. And I always tell the students example, if you make the when you slaughter the animal on Eid, Eid al-Adha.
Yeah.
You slaughter the animal, you bring the meat, and the meat is doing like this. Maybe someone of you have observed it. Fresh meat. It is doing like this. This is called fasciculation. If you cannot see it, but record it with the electrode, then this is called fibrillation. We have two words, fasciculation and fibrillation. I have got one full slide for it. Denervation, supersensitivity, and reaction of degeneration. So flaccid paralysis. These points now, okay? This point. Paralysis of the denervated nerve with loss of all type of movement, voluntary, postural and reflex, all movement finished. Listen. No reflex. This is the main difference. All reflexes are lost. What is fasciculation? What is fibrillation? Have I told you this? So fasciculation, visible contraction of all the motor units. It is because of the spontaneous generation of action potential in distal segment, this one, not the proximal one, distal one. What is fibrillation? Which we cannot see. It is invisible to observer. How do we know it? If we put the electrode on it, electromyography, then we can detect the small changes. So these are the functional effects of the lower motor neuron layer. Now, when you cut the nerve, this area becomes more sensitive. This is called supersensitivity after the denervation. Remember, I am not discussing sensation. I am just discussing motor system. If the motor nerve is cut, so the area, it becomes more sensitive. What is the reason? Now read it carefully. It is because of the increase in the number of acetylcholine receptors, because of which this area becomes supersensitive. This makes it MCQ. That what is the cause? Right on his MCQ. Because what causes denervation supersensitivity? It is the increase in the number of acetylcholine receptors. And my dears, the biggest thing, if there is no nerve regeneration, or he brings the new nerve, what will happen to the muscle? Atrophy. So the result is atrophy. Now, if you stimulate the physical therapy guys, if you stimulate from here, can you stimulate this muscle? No. If you stimulate from here, can you stimulate this muscle? No. You have to make your stimulations here.
No.
You have to find the nerve and you have to stimulate it distal. So, abnormal response of denervated muscle to the electrical stimulation. My dears, these are the last of the last 3 slides. I will not read everything. You will read it just before you prepare for your exam.